Bismillahirrahmanirrahim. Today we are going to discuss another important topic, and that is infarction. Infarction, it is obstruction of the blood supply to some organ or some specific tissue, usually by a thrombus or an embolus, and this obstruction it causes the local death or local ischemia of that tissue. So this is the definition of infarction. In the next slide we'll come across the definition of infarct. When speaking about the underlying cause of infarction, it is usually the thrombosis or the embolism, and generally arterial thrombosis and arterial embolism, it underlies vast majority of the cases of infarction. Few of the very common examples of infarction which we come across, like the infarction or the gangrene which develop in the extremities of a diabetic patient, that is quite a serious complication. Similarly, pulmonary infarction is also a common complication in various clinical conditions. Bowel ischemia or mesenteric infarction, typically that is present in old age people who are suffering from some atherosclerotic plaques. Other less common causes, they may include vasospasm of the blood vessels, obstruction of the blood vessel as a result of some trauma. Similarly, volvulus, and another important cause of the bowel ischemia that can cause infarction. So these are the few important causes of the infarction, or it can be said that these are the examples of infarction. In the next slide, we'll have a look on the definition of the infarct. This slide, it shows the definition of infarct. It is again important from your OSPE point of view. So here is the definition. An infarct is an area of ischemic necrosis that is caused by occlusion of either the arterial supply or the venous drainage. So this is the exact definition of infarct, and as I already told you, it is important from the OSPE point of view. Now, few important points about the morphology of the infarct. We classify the infarct according to colors. One is red infarct, and second important variety, that is the white infarct. If we talk about the red infarct, it usually occurs with the venous occlusion, and the tissues in which red infarct develop, they are usually loose and spongy, and these tissues, they usually have dual circulation like intestines, and we also have another important example of the lung tissue. Similarly, another important feature of the red infarct, that it develops in those tissue where the venous outflow, that is very sluggish, and this sluggish venous outflow, it causes the congestion of the organ or the tissue. And fifth important point or the feature about red infarct, that it can develop in those areas where the previous blood supply that was occluded, previous arterial supply that was occluded, and after the occlusion, some process or some intervention has been done, like angioplasty has been done of some occluded artery, and after the angioplasty or after the repair of the artery, the blood flow is again established to that side, and it may result in the necrosis. So these are the few important features of the red infarct. If we talk about the examples of the red infarct, they include the testicular tissue, lungs, and intestine. So these are the important examples of the red infarct. So this is a gross picture of the lung, and you can see the lower portion of the lung lobe, it contains an infarct, and the color of this infarct, that is red. So the main classification of the infarct, it is on the basis of color. This is the red infarct that is present in lungs, intestine, and testicular tissue. Second important morphological classification of infarct is the white infarct, or they are also called as anemic infarct because of their color. These white infarct, they occur in those tissue having arterial occlusions It can occur in those organs which have an end arterial circulation, and similarly these anemic or the white infarct, they can occur in those organs or tissues which limit the amount of hemorrhage that can seep into the area of the ischemic necrosis from the adjoining capillary beds. So the most important tissues or the organs which are the main examples of this white infarct, they include the kidney, spleen, and the heart. So this picture, it shows a huge white infarct. You can clearly see that this white infarct, it is well demarcated from the surrounding area. In this slide, we'll discuss a few important morphological features, both gross and the microscopic, of the infarct. One of the very important gross morphological feature of infarct is that it has a wedge-shaped appearance. The occluded or thrombosed blood vessel, it is usually present at the apex of the infarct, while the periphery of the organ, it forms the base of the infarct. So this is very important about the uh, gross shape of the infarct. When we talk about the fresh infarcts, they are usually poorly defined. They are not well demarcated from the surrounding area. But however, with the passage of time and after a few days, the infarct, it becomes well defined with a small rim of congested tissue, and that small rim of the congested tissue, that is mainly due to the inflammatory process that is going on actively. And the inflammatory cells, they are usually the acute inflammatory cells in the earlier days of the infarct. So the dominant feature, the most important microscopic feature of infarct is the ischemic coagulative necrosis. As you can see in the point number 1, I have clearly mentioned it, ischemic coagulative necrosis. And the second important feature is the acute inflammation, as I mentioned previously. Acute inflammation may not develop immediately, or it cannot be seen immediately. However, these histological changes, it may take some time, like it may take few hours, for example 4 to 12 hours to develop. And the acute inflammation, as I already pointed out, that it is present along the margins of the infarct, which were initially not well demarcated, which were initially congested. So the congestion of those margins, that is due to the acute inflammation. So acute inflammatory cells, the neutrophils, they are present along the margins of the infarct. And the margins of the infarct, they become well demarcated or well developed by 1 to 2 days. After the acute inflammation, it subsides. Generally, chronic inflammation, it starts its process, which includes mainly the macrophages and other chronic inflammatory cells. The M2 type of the macrophages, they start the they start the healing response or reparative response, and ultimately the infarcted area or the infarcted portion, that will be replaced by a scar. But important point to note here is the brain. The brain is an exception to these processes, because in brain there occurs the liquefactive necrosis, while in other organs there occurs the ischemic coagulative necrosis. So this should be kept in mind. And also, this is very commonly asked question, that which of the following necrosis that is seen in the brain, and the answer is the liquefactive necrosis. This is a microscopic picture of an infarct, and this is from acute myocardial infarction. You can see two arrows. One arrow that is pointing on the infarcted area, that is relatively pale as compared to the other adjoining area, and the arrowhead, that represents the relatively viable area. So note the pale color of the infarcted area, and as I already pointed out that this is a myocardial infarction. So in myocardial infarction or in the heart, pale infarct or the white infarct that is seen, so the area that is pale, and it has been well demarcated from the surrounding area. So this picture, it shows the microscopic features and the demarcation between the viable area and the infarcted area. If we talk about the second classification of the infarct, they are usually classified on the basis of the presence of septicemia or the absence of septicemia. If there is septicemia, that is will be called as septic infarction, or if no evidence of sepsis is seen, that will be called as bland infarct. Talking about septic infarct, they occur especially in the case of valvular vegetations. These valvular vegetation, they embolize, or when the microbes or the bacteria from these vegetation they seed the necrotic tissue. In these cases, the infarct that is ultimately converted into a necrotic tissue, and the necrotic tissue that ultimately it results in the development of an organizing abscess, and an abscess that consists of abundant necrotic debris along with the acute and the chronic inflammatory cell infiltrate. So this is a brief description about the septic infarct. Moving on to the last slide of today's lecture, these are the various factors that are associated with or that influence the development of an infarct. They are the anatomy of the vascular supply, rate of occlusion, tissue vulnerability to hypoxia and hypoxemia itself. Anatomy of the vascular supply. Numerous organs are present in our body, and few of these organs they contain dual blood supply. For example, liver, and another important example is the lung have a dual blood supply from the pulmonary and the bronchial vessels, while liver, it has dual blood supply from the hepatic and the portal circulations. So these organs, they are less prone to develop ischemia as compared to the organs like kidney and the spleen, which only contain a single blood supply. So anatomy is very important. The vascular supply is very important of an organ that may influence the development of infarct. The second important factor is the rate of inclusion. If a blood vessel it occludes on a slow rate, it will be less likely to cause infarction. Because the slower the rate of occlusion, it will provide more time for the development of the collateral pathways, and the organs it can perfuse itself from those collateral blood vessels. So decreased rate of occlusion of a blood vessel, it is not that much associated with the development of infarction, the main thing being the development of the collateral circulations or the collateral pathway. Third important factor is the tissue vulnerability to hypoxia, and this is particularly true for the permanent cells. For example, the neurons and the myocardial cells. The neurons, they can undergo irreversible damage or hypoxia even if they are deprived of blood supply for 3 to 4 minutes. Similarly, if we talk about the myocardial cells, they can undergo irreversible damage and the tissue ischemia and hypoxia if they are deprived of the blood for about 20 to 30 minutes. The next important factor is the hypoxemia. Hypoxemia, that is the abnormally low blood oxygen, it increases both the likelihood of the and the extension of the infarct. So these are the four important factors, and they can be asked maybe OSPI में अगर पूछ लिया जाए, name the factors that influence the development of infarct. अगर 2 number का पूछा तो just write the names of these factors, and similarly if there is a complete SQs to write few points about these 4 important factors. So this was the lecture about infarction. Our next lecture will be about shock, another important topic, and that will be the last topic of the hemodynamics. Till then, Allah Hafiz.